we're sitting here 5 years from now, and thanks to your company, what are you looking back in 2024, amazed that from a healthcare perspective, women were X. What's changed, and what role has your company had in creating that change?
Good morning and good afternoon to everyone. I'm Dr. Fahima Sassan. I'm a board certified OBGYN, Kindbody's founding physician, and also serve as our Chief Innovation Officer. And I think what I would highlight we do in 5 years is actually what we do today as well. And I think it's really merging together virtual telemedicine with in-person care and recognizing that truly the combination of virtual care along with the in-person care and having that continuity that we provide is such an essential part of medicine when it comes to fertility, reproductive health, menopause, through all of the stages. And so really being able to, from the convenience of a person's phone or digital platform, tie in the digital to the virtual, to the in-person care, whether it's diagnosing, managing, or treating the full spectrum of reproductive health, including male fertility, which is obviously a huge aspect of infertility issues. And as we look into 5 years from now, it's really taking that woman from menarche to menopause and everywhere in between, and men from puberty to that low testosterone andropause period, and recognizing that there's so many deserts, both from a physical perspective as well as a care perspective in the United States that need to be addressed.
Based on what you're doing today, if you could share one real outcome, short story or use case that is happening today and positively affecting the women that are using your product.
Yeah, there's again, I want to echo so many stories, but I think the most profound thing that Kindbody has done is the story through our Center of Excellence program with Walmart. So Kindbody today serves over 3 million people through their employer benefits, so that they're now having access to fertility and family building benefits, including adoption and surrogacy, that they would not otherwise been able to. And the Walmart story is particularly important because it's people who would have otherwise never had access to this care, part-time truck drivers, cashiers, people who would have never been able to afford IVF care or have access to this type of care. And so the one couple that comes to mind is a couple who's from Somersville, Kentucky. I had to Google it because there's only about 300 people that live in Somersville, Kentucky. You can imagine a town that has 300 people certainly doesn't have a fertility clinic, much less a lot of subspecialty services. And this couple had been trying for 6 years as a young 30-something-year-old couple and had had 12 inseminations because that's all that was available to them in their even neighboring towns. And we met with them virtually because that's the way the program works, trying to reduce the impact of travel. Met with them virtually, was able to do their workup for them virtually, and then they only had to travel once to their nearest Kindbody clinic, had one IVF retrieval, one embryo transfer, and their baby will be celebrating its first birthday in a few months. And so I think it's stories like that. And this is just a person who works at the local Walmart, of a town of 300 people, as a blue collar worker. And I think it's those stories that really, give us our mission and vision. And I'm sure is true for everyone that's on the call. But the access to care, I think, is the most profound story that I would share.
Well, what I'm going to ask you to do, because I think so much of success is around your team and your company and the humans involved in your company, and you folks are the leaders. So I want you to come up with just 3 words that define your team, what keeps people excited, how you're being sure that you get inclusion of different voices, and given the time, literally 3 words or 3 phrases that best describe what differentiates the humans in your company.
I'd say leading with empathy and kindness and being innovative.